And welcome back. Well, if you have tired, swollen legs and they get worse throughout the day, then you may have vein disease.
And you're not alone. Vein issues affect about 25% of our population. And here to chat about some of the common issues is Dr. Deborah Manjoney with the Wisconsin Vein Center and MediSpa. Great to see you.
Good morning. Thank you.
Important topic, I think, and things have come so far. That's the important thing for people to know in terms of diagnosis as well as treatment. So let's get into the fact that, of course, the appearance is unsightly, but there are also problems because it can cause symptoms that affect your life.
And actually can cause complex problems later on, complications from vein disease. And so, you know, if people have fatigue and heaviness in their legs at the end of the day and they think that's normal, it's not. You know, especially if you have varicose veins, then maybe that should be evaluated to see if there's something that can be done for you, because something can be done for everybody with varicose veins in a real minimally invasive way.
What are some of the modern approaches to varicose veins?
Well, some of the modern approaches include laser treatments, where we can just thread a little tiny laser fiber that's about the size of a raw spaghetti up into a vein and then close it as we're withdrawing the laser. And it works beautifully. It has over a 99% success rate at a year. And so in our hands, it's been fabulous, and we've been doing it for 18 years now.
Is that for big bulgy veins? Or
no, it's actually not necessarily. The big bulgy veins aren't usually straight, and so it's not something you can do and thread something in, but will affect those big bulgy veins and make them get smaller. But we frequently will just do something as a combined technique where we can get rid of the big bulgy veins at the same time we're closing the vein that's causing the problem with the laser. Then we'll remove those big bulgy veins through little tiny needle punctures after we've just used a local anesthetic in the skin.
It's interesting the difference between the normal versus the diseased veins, because it is definitely cosmetic in many cases.
Correct.
But even when you take a look underneath and you get an inside look, there's a big difference.
That's right. Those little valves that we see, those little leaflets there, are one-way valves, and because we need those in our veins, especially in our legs, because of gravity. And so if we don't have those, and the blood can't leave our legs, go back to the heart and lungs, and that's what the veins are trying to do, carry that blood back up. And so if the valves aren't working, then the veins stretch out, they get bulgy, and they have to elongate to accommodate that excess blood, and that's when we start to see those branches becoming as tortuous and as like snake-like, you know, under your skin.
So I've had veins before injected. Do you still do that as
Absolutely. The spider veins, the smaller veins that don't have necessarily any underlying pathology, can still be addressed very nicely with a surface laser and injection therapy. And, you know, we customize to each individual what they might need.
That was so simple.
It is, but that's a process. It's not a one and done.
Right.
And so people have to understand that it's a cosmetic thing that's going to take at least 2 to 3 treatments to improve those appearances. But it can help. People can even have itching and burning in those and throbbing in those little tiny veins, and we can handle all that.
I did. I was amazed that because it was just cosmetic, how much difference though I felt in my legs. Even though they thought, well, there shouldn't be a ton of symptoms, but truly they felt so much better.
Some people really notice a big difference. Yes.
So there's a variety of techniques. Some are very popular now. There are additional procedures too that can be done at the same time to eliminate the bulges, like you said. And all of them are done in office, where the recovery is so much more rapid than it ever used to be.
In office, people walk in, walk out with elastic compression hose on for a few days, resume normal activities either immediately or within a day, and feel great, you know, and they will notice an improvement in how their legs feel very quickly.
What do you want to say about DVT awareness?
Okay, so this is DVT Awareness Month. Deep vein thrombosis is one of the chief causes of hospital deaths, for sure, in this country. And it means you get a clot in the vein, the deep veins underneath your muscles in your legs, and it can cause swelling in the leg because it's obstructing the major vein return from the leg. And also those blood clots can break off and go to the heart, and that's where you see the mortality, because it can obstruct the arteries going to your lungs, and people can't breathe, they can't get oxygen into their lungs, and it can cause death when that happens.
This is a popular time of year for traveling.
That's
we tease this because travel can be associated with DVT.
It absolutely can.
What recommendations or advice do you have for traveling specifically?
Well, there are exercises. We want you, of course, to get up and move around. So if you're sitting in a plane, or if you're avoiding plane travel right now and sitting in a car, don't forget you're still at risk because you're in a confined seat. And so stop often, every hour and a half or so. Get up, move around, stay hydrated. Maybe take an aspirin before you go, so you're keeping your blood a little bit on the thinner side, and do some exercises even while you're sitting down.
Can you just pump your legs?
Pumping your legs, very important. Just bend your knee and pump your foot back and forth. That helps. Do that about 10 times every hour. definitely makes a difference.
Okay.
And as I said, we have a whole bunch of different exercises that you can look on our website and see. And it makes a difference really in trying to prevent DVT.
That's good.
The other thing is if you're sitting for a long period of time, wear a graduated compression sock. You can buy them easily now at bike stores and running stores. They're great, and even at shoe stores, stands.
And they're not as ugly.
That's right. And they can be really fun socks.
Cute.
But it's going to make a difference. It's going to help prevent this kind of thing.
Okay.
Real quick, it's World Lymphedema Day.
That's right. Lymphedema is a very sad disease process.
This picture that we're going to show
And
is a
there's
little hard
primary,
to see.
people are born, about 1 in 300 births have congenital lymphedema. And this is just staging of lymphedema in the legs. It affects over 250 million people worldwide. In our country, the major causes are after cancer surgery. You might get it in your arm after breast cancer, or in the legs after other surgeries. But it's a disease that has been ignored, and actually until the last year, there wasn't even any treatment that was financially reimbursable for people from their health insurance policies. And now it finally is getting some recognition. Kathy Bates is the American ambassador about this.
Okay.
But this is just to bring awareness to this awful disease process that affects so many millions of people through the world, to try to get the World Health Organization to make this a priority for 2020, to really address this. Most of the world is affected by a parasite, filariasis, that can really obstruct the lymphatics. But in our country, it's more of a post-cancer thing or congenital. But it's a very sad condition. There's not a lot that can be done right now to address it. There are some really advanced techniques where they can transfer lymph nodes to an area where the lymph node had been removed or had been affected by cancer. But those are only done in really specialized institutions because it's a microvascular type of technique to connect everything. But there are compression garments, there are at-home things that we can do now to help people reduce this. But it's just for awareness, to please be aware this is such a devastating disease, and these people have been ignored for so long.
Yeah. Well, thank
Really
you for raising
important.
awareness for it as
Yeah,
well.
I think that's wonderful. A lot of things to keep in mind. You can do a consultation to have your veins looked at. Diagnosis is easy often as an ultrasound. You should call the Wisconsin Vein Center and MediSpa. Don't wait. Address those symptoms. 262-746-9088. WIMedispa.com. And varicose veins very often are covered by insurance.
Yes,
Important
they are.
to note.
Treatments are very frequently covered.
Thank you so much. Appreciate it.
Thank you.